Let's start. A 63-year-old female was presented to the emergency department with severe headache and vomiting that started 2 to 3 hours prior. She also has severe pain on the right eye, right eyebrow, and cheek. She's nauseated and has vomited twice since feeling the pain. She has noticed blurry vision from right eye and rainbow-colored halos around the lights. Denies flashes and floaters. She uses prescription glasses for reading. Smoker since age 20, drinks alcohol on occasion, denies any illicit drug uses. History of diabetes, degenerative disc disease in lower back, and seasonal allergies for which she is on medications. Now, the question is, click to highlight 4 areas that need immediate follow-up. Okay? So that's the question. What do you think? And like I always say, try to make a picture of this person, a 63-year-old female coming to the emergency department, and this is going on, and she's sitting there, and you are talking to her and trying to get all this history, and trying to figure out, is it something emergency, or is it something like, which you can refer to a doctor later, or is it something where you have to act real quick so you can prevent some permanent damage, or what's going on? So what are your thoughts, and what are the 4 areas? It says 4 areas. So it gives you a clue, 4 things you have to figure out which need immediate follow-up. I'll show you here. Severe headache and vomiting, that's going to be one thing we are so worried about, because that's not okay to have severe headache, and look at that. It's like, it's not like you are having like migraine headache or some kind of headache for some time. Usually when people get headaches, it's like, gradual onset, and it will be there for maybe a day or maybe like few hours, more than like 2 to 3 hours. But this person, it's only been 2 or 3 hours, and it was so severe that she had to go to the emergency department for that. So headache and vomit, especially when it is associated with vomiting. Okay, now the other thing is there is pain on the right eye, eyebrow, and cheek. So her right side is like really hurting. And there is blurry vision from that eye, and she sees halos around the lights. So those are going to be our major 4 things which need immediate follow-up. Now you might be thinking, but she also, she's a smoker for 20 years, and that's too much. Does that need follow-up? Okay, it's bad, but is that going to kill her right now, today? Is that the reason she's here? Because she was smoking for 20 years? No, that's not the reason she is here. Okay, I understand she has history of diabetes mellitus. And will that need follow-up? Probably. But is she here because of diabetes? Is that the reason she's here? Is that really bothering her that suddenly, like within 2 to 3 hours, she was like, I have diabetes, I need to go to the emergency department? Is that why she's here? No. So that also is concerning, because we need to figure out what's going on. But at this moment, if I have to choose 4 things, this diabetes or degenerative disc disease or lower back pain or seasonal allergies are not going to be on my list of priority. They are there for me to check on, but it is going to be towards the bottom part of my list. The nurse is taking a list of home medications, because she said that the client said that she is having diabetes, that she is diagnosed with some kind of degenerative disc disease. And she also have the seasonal allergies. So we need to know what kind of medications she takes, right? Because it might be important and might be contributing. So it says she takes metformin for diabetes, which makes sense, very common medicine. Diphenhydramine for seasonal allergies. Again, it's like Benadryl and antihistamines, which people take, especially when they have the seasonal allergies. Most of them don't go to the doctor for allergy medicine. You just take over-the-counter medicine, right? So that's also something which is very common. Naproxen for back pain, and it's like as needed basis, which means it's a non-steroidal anti-inflammatory drug. So she don't need it maybe every day. Yes, she has the degenerative disc disease, which is not probably going to go away because it's degenerative and she's 63. So the age may be also contributing towards that. And so what she does is she takes medicine whenever she really needs them. And that looks okay. And the vital signs are temperature 98.2, heart rate is 102, respiration is 22, blood pressure is slightly elevated, right? 148/86. Now, she didn't have history of hypertension. I mean, she's not on any medicine. She's not diagnosed with hypertension, and she's not on any medicine for hypertension either, right? But she has high blood pressure. According to our, when we look at it, she has hypertension. And she also have tachycardia. What could be the reason? What do you think? Is she having really bad hypertension also? Like she is, it's not diagnosed, or is there any other reason? Can you figure out something which might be contributing towards this blood pressure and this heart rate at this moment? Pain, anxiety, severe pain, and my eyes, I cannot see from one of my eyes, and I will be freaking out, right? It is possible that she is having some underlying issues, cardiovascular, but at the point, I think it's more because of the pain and the anxiety. All right, so there is that. Now let's look at the physical examination. It says there is mild redness in the right eye. The right eye pupil dilated and sluggish to respond to light. So I'm thinking the nurse did the, light and the perla. She was probably looking for the perla, and there is dilation on the right. I mean, right side is the one which is having problem, right? And it's sluggish to respond. Left eye, no problem. Left eye is reactive to light and round, and that seems okay. And intraocular pressure. So I guess the doctor did the intraocular pressure, and it's 62. What do you think about that? 62. What is the normal intraocular pressure? Yeah, it's 10 to 21. Intraocular, not the intracranial. We are talking about the pressure inside the eyes. And the normal is 10 to 21. It can range between 10 and 21, depending on what time we are checking. But intraocular pressure can vary throughout the day. It's usually a little bit higher in the morning and kind of stabilizes towards the day. But still, it will be between that 10 to 21. That's why it's a big range. But this is really high. 62 on the right eye is really, really high. So now that you have additional objective data, right? I mean, you have all this information from the client, but now you have additional objective data, and you know the intraocular pressure too. Now let's look at the third question we have. It says, the nurse suspects that the client's symptoms are due to, there are 6 options, and you can select only one. What could be the reason now that you have all this information? Is it diabetes? Is it because of macular atrophy? Is it because of angle closure glaucoma? Is it because of retinal detachment? Is it because of smoking and alcohol? Is it because of medications? All right, really good. It is, we know now, at almost certain that this is angle closure glaucoma, because that's the pressure problem, right? So now, as evidence by what? You can select only one from here. Is it because you are saying that this is angle closure glaucoma? Is it because of tachycardia? Is it because of increased blood pressure? Is it because of increased intraocular pressure? Is it because of sluggish response of the pupil? Or is it because of the home medications? It is increased intracranial pressure, right? So we can say this is angle closure glaucoma. We know it is angle closure glaucoma because of increased intraocular pressure. Now, is this okay to select? And my answer will be not at this point with these choices. Okay. Now, if the increased intraocular pressure was not there, I would have selected D. Sluggish response of pupil to light would have been my next best answer. But because there is more appropriate, more focused for glaucoma, because increased intraocular pressure really is focused for the glaucoma, I will select that. Sluggish response of the pupil can be of so many reasons, including in the problem with the glaucoma, but it could also be because of many other problems. So if I have to select one which is really connecting the glaucoma, I will go for the intraocular pressure. In NCLEX, there could be choices which appears to be good, true, but there is some better ones, and we need to go with the better ones. Now, how do you figure out which is the better one? When it is more focused on the question. Okay? All right. So now we have one more. The question is not over yet. We have one more. It says the client is at increased risk of permanent blindness due to, there is angle closure glaucoma, there is increased intraocular pressure. So there is chance of permanent blindness. But why? Why? Okay, it's because of optic nerve ischemia. Right? That is the issue. So when the pressure goes up, in the, this is the slide which I think I have used it in our video lessons too. But when the pressure goes up inside, it is going to put all the pressure into this optic nerve, which is towards the back. And that optic nerve is going to get compressed. And if it is not relieved on time, if the patient has not being seen by a doctor and the appropriate medications or procedures or whatever is needed, if it is not done on time, this pressure is going to cause damage, and its permanent blindness can also happen. So coming back to our question, our answer to this one is, it is angle closure glaucoma. It's evidenced by increased intracranial pressure, and it is going to cause permanent damage. If you don't do something about it, it can cause permanent blindness due to the pressure in the optic nerve.